Hello, welcome to This Week in Medicine. Thanks for joining us on November 29th, 2021, brought to you by the Foxall Foundation. We have a wellness center, we have a nutritionist, we have yoga classes and key adult movement classes sponsored by the Foxall Foundation. I believe the times have changed for our yoga class. We have one on Wednesdays at 8 p.m. and on Saturdays at 2. And we're continuing to work out more classes at our center aimed at wellness through the age spectrum, exercise, nutrition, fitness. So what stressed us out this week? What came into the inbox at my office? Well, Thanksgiving was stressful because people wanted to get together. There's a high rate of vaccination in our area, so of course a lot of people were trying to get together for the holiday, and we answered a lot of questions, and certainly there were some people who had COVID exposure and unfortunately had to mask with their families, but I'm happy to report of everyone who told me they had COVID exposure, everyone was able to get through the Thanksgiving holiday, either wearing a mask, doing testing, or thankfully finding out that they really weren't exposed. So it was good news on that front, not too stressful. Still problems with interacting with the unvaccinated, which happened because people traveled for the holiday. Vaccine for kids is still problematic, although certainly approved. There is not a high uptake for vaccination in the 5 to 11-year-old age group, probably about 30 to 50%, depending on where you look. And probably the biggest stress of the holiday weekend is the Omicron variant that came out of South Africa. Another good point from the weekend, as a University of Michigan alum, both for undergrad and medical school, was that we won the big game. And the big game was against Ohio State over the weekend. We'll get to that in a minute. There's a new wave of COVID spreading through Northern and Eastern Europe. We talked about that 2 weeks ago. That continues. We still have winter holidays on the horizon, people being indoors more, so more concern about COVID spread because of being indoor. Another stress is the scarcity of the Moderna vaccine, and honestly, looks like the scarcity of Christmas trees. All of that stressed us out this week. So as the fight song goes at the University of Michigan, we're the leaders and the best. But unfortunately, over the holiday weekend, the state of Michigan became the leaders in COVID rates. It's now leading the country, even though Michigan has 3% of the country's population. They were definitely leading in COVID cases in the United States last week. There was a dramatic uptick. They rose 18% in the past week. And then here is the victory celebration after the University of Michigan beat Ohio State in the big house. The fans rushed the field, 2 of which were my nieces who are fully vaccinated. Nonetheless, when you see a picture like this and you see that everyone is not wearing a mask, they're celebrating a huge victory, but at the same time, Michigan accounts for 1 in 10 new COVID cases in the current surge. This could make you a little nervous. It's nice to be the leaders and the best in football, which clearly we are, but it's not so great to be the leaders and the best in COVID cases. And certainly this has something to do with the low vaccination rates in certain parts of Michigan. Rising case rates in Europe. This is a slide from 2 weeks ago where Austria was leading, and then Austria had a lockdown with COVID passes. So if you showed your vaccination, you were able to leave your house, but if not, they wanted people restricted to their homes who were not vaccinated. This trend continues in Europe, due in large part to decreased vaccination percentages. This is a new slide for this week. This is the COVID-19 situation in Eastern Europe, worse than ever, with new travel rules being proposed. The dark brown is the positivity rate, so you can see in this big swath of Europe, large positivity rate for COVID. Italy, which was at the epicenter of the first COVID surge, not looking too bad. They're in the orange, not this dark brown. But you can see that unfortunately the COVID rates are really up in Europe, and so this is causing some lockdown and restrictions in travel. And then over the holiday weekend, we had the Omicron variant. At first they were going to call it new. That lasted about 2 hours. And then they called it Omicron. It was found in Gauteng, South Africa, or Gauteng, South Africa, if you're a local. This is a very small area geographically in South Africa, but clearly this province takes up a huge percentage of the population in South Africa, with an estimate that there are 15 million people living in this area, which represents 1.5% of the landmass of South Africa. So it started there. There are only 37.4% of the population in this province who are fully vaccinated. 37.4%. The Pfizer vaccine was returned due to oversupply in South Africa. We'll go over that in a slide in a minute. So it may not be that 37.4% are fully vaccinated because they don't have access to the vaccine. It may be due to vaccine hesitancy. Because of this, there are travel restrictions that were imposed over the weekend, with restrictions against people leaving not just South Africa, but Botswana, where this may have started, and other parts of southern Africa. There are 32 or maybe even 50 mutations in the spike protein. The spike protein is the target for vaccination. So the mRNA vaccine specifically targeted the spike protein. So this is making people nervous that if we have this many mutations, are our mRNA vaccines still going to be effective against this virus? We just don't know enough, but we expect to know more in 2 to 3 weeks. Molnupiravir and Paxlovid, which are the two drugs that have been developed, and EUA has been sought from FDA, emergency use authorization, don't target the spike protein. So it may be that this mechanism is still valid for the drug approach to treating. There are some reports that this might be a milder disease, but clearly more transmissible, because in this province there was definitely Delta predominance, and then suddenly a huge spike. Maybe some of you have seen this slide. It was a blue line spike in cases that were not anymore Delta. It was this Omicron variant. But the reports of some of the people who have this illness are obviously not that they are on ventilators. So could this be a milder form of the disease, but more transmissible? We'll have to wait. We need more data. So the percentage of South Africans in the province we were just looking at, Gauteng, which is where Johannesburg is, and Pretoria, it's pretty low, 37% right there. Western Cape was a higher percent, but if you look at all the provinces of South Africa, they don't go above 50% vaccination. So as of November 22nd, nearly 41% of the adult population in South Africa had been fully vaccinated. So I know that in the United States we are concerned about our low vaccination rates, but this is a global phenomenon. Vaccine hesitancy is a global phenomenon. This is not just something the United States is dealing with. This is a human behavior. Vaccine hesitancy, the human behavior. South Africa has asked Johnson & Johnson and Pfizer to delay delivery of more COVID-19 vaccines because they have too much. The stock is high, health ministry officials said. This was released on November 24th in U.S. News. Vaccine hesitancy is leading to an accumulation of vaccinations. So they have the vaccine, but they have 37.4% of people fully vaccinated. So again, just as we have problems with vaccine hesitancy, this is a global problem. We need to emphasize the safety, the efficacy, and the intelligent design of these vaccines. Really, it's a breakthrough in modern science, and getting over the vaccine hesitancy of our global population should be our main goal to control this pandemic. They have enough vaccine, clearly. They've asked Johnson & Johnson and Pfizer not to send them anymore. One of the reports I read said they had a vaccine enough for 168 days. So clearly there's enough vaccine. It's just getting it into the arms that's the problem. The molnupiravir data was reviewed, and it actually looks like it has decreased efficacy. When I first reported on this a couple of weeks ago, I told you it looks like it was 50% effective against hospitalization and death, but the data was reanalyzed, and it looks like it's 30% effective. That's actually the same efficacy as fluvoxamine or Luvox. It turns out that the selective serotonin reuptake inhibitors, or what we call SSRIs, which are our modern antidepressants, actually seem to have some efficacy against COVID-19. So Luvox in particular, this antidepressant fluvoxamine, is about 30% effective against hospitalization and death. So that's the same as molnupiravir. So it's interesting. These drugs are often generic and cheaper. So maybe molnupiravir isn't the great drug that we were hoping it would be. Now, Paxlovid had a much higher efficacy, and they have applied for emergency use authorization. The FDA meets actually tomorrow to discuss molnupiravir. I'm not sure when the date is for Paxlovid, but at least that looks more promising. And of course, molnupiravir was already approved in the United Kingdom as a pill treatment for COVID. Again, this is about the pills we can use to treat COVID, molnupiravir and Paxlovid. Again, anybody can get a booster over 18, so the FDA expanded its eligibility for COVID vaccine boosters. And I think, at least in our area, it's hard to get an appointment right now because everybody's trying to get a booster. No doubt increased in demand because of the recent variant over the weekend. So again, everybody can get their booster at any time. Tony's tip of the week. Please check your refills before the long holiday comes, the Christmas and New Year's holiday, because sometimes it is difficult to get your prescriptions filled when the office isn't open. Different states have different regulatory rules, and I know I have many patients in many states. Some people are traveling, some people just live throughout the country and are patients. So if you need refills on some of the controlled substances, just realize it's really hard to get this through during holidays, mostly because the regulatory agencies that we use for prescriptions like it when our office is open and slow down on weekends and holidays. So anticipate that for the end of the year. Again, holidays and weekends are slow. We use a 2-factor electronic verification for controlled substance prescriptions, which means that we're using a cell phone verification and a computer verification that allows us to do controlled substances by electronic prescription. That's not very effective on the weekend. It really slows down. This is due to decreased speed on the weekends from these companies that allow us to do electronic prescribing. Electronic prescribing is taking over in the prescription arena. There are certain states, I believe Pennsylvania is one of them, that is requiring all controlled substance prescriptions, which are this list here: the benzodiazepines, the narcotics, tramadol, ADD medication. It all has to be done electronically. Paper prescriptions will no longer be allowed. Also, please check your annual prior authorizations on certain medications. Certain medications are not covered by your insurance unless we go through the process of calling your insurance and getting those approved. And usually they're approved for a year. For many patients, it's the proton pump inhibitors, omeprazole, Nexium, esomeprazole, pantoprazole, lansoprazole. All of those medications sometimes need a once-a-year prior authorization process, and Tony does that in the office, but it does take a day or two to go through your insurance. BPH drugs like tadalafil or Cialis often require a once-a-year prior authorization. Testosterone patches, Ambien, and name brand medications all require a prior authorization. We do this once a year, and it usually gives you your 90-day prescription and then refills, 2 or 3 refills. So think about that for the end of the year. And the fast pitch, actually, Schurz got traded to the Mets today, so he's making the rounds. December 1st is HIV/AIDS Awareness Day. That's this Wednesday. Get a booster of Moderna or Pfizer if you're over 18. Continue to wear your mask due to Omicron and the unvaccinated, which really kind of go together. I don't think we would have had the evolution of Omicron if it weren't for an unvaccinated population. So the vaccine is really going to help us prevent more variants and more virulence. Check the status of your prescriptions and see if you need an annual prior authorization. Try and get that going now. And right now there is a combined COVID influenza RSV nasal swab. RSV is respiratory syncytial virus. It tends to be very dangerous in little kids, but it also can create respiratory illness for adults. And we've already been seeing quite a bit of RSV in the past couple of weeks. It's very similar. You have a very runny nose, fever, not the body aches and not the severe systemic symptoms of COVID, but nonetheless a nasty upper respiratory illness. So we can test for that with nasal swabs when we do COVID testing, and it stands to reason we should do all of those together because they're very similar respiratory illnesses. Again, remember, Building Your Pyramid of Health. We'll be out with a book hopefully in the next year that analyzes all these different sectors of your health. And remember, there's no such thing as heart disease. It's mostly just natural aging. So make sure you check in with your doctor, myself, your cardiologist, and make sure that you've had your cardiovascular health assessed for where you are in the age spectrum. And that's it for this week. Thank you.